Hi there, I'm Steve Smith, CEO of Airlink, and thank you for joining me for another episode of FlightPath, where we highlight innovation and deliver insight, guidance, and lessons in best practice to people working in the humanitarian response and disaster logistics space from experienced organizational leaders. My guest today is a highly experienced senior executive and humanitarian affairs specialist who has designed and implemented relief, transition, and development programs in some of the world's most difficult environments on 4 continents. He has served as policy advisor to US government officials, government agencies, think tanks, universities, NGOs, and foundations in the humanitarian affairs field, and he has testified on numerous occasions before Congress on humanitarian emergencies and response options. And he's also the recipient of the Thomas Jefferson University's Grace Humanitarian Award. Currently, he's CEO of Project Hope. Rabih Torbay, thank you so much for joining me today.
Thank you. Thank you for having me.
Great. Well, before we kick off, I want to declare an interest. Airlink and Project Hope are good partners, and we've worked together on a number of missions before. And we're also currently working on one at the moment, as it happens, for COVID-19. But Rabih, welcome. Let me start, if I can. For people that may be unfamiliar with Project Hope, why don't you tell our audience a little bit about the organization and some of the missions you've been engaged in, if you would?
Sure, I'd be happy to do that. But before I do that, let me just mention that Project Hope and Airlink have been great partners, not just good. And the support that you've given us over the past few months has been tremendous. We couldn't have done our response without your support, and we really appreciate you. And I appreciate your donors as well, who've been supportive of you supporting us. As you know, Project Hope is a global health organization. We've been in existence for over 60 years, working all over the world. And we focus on disaster response, but also development. We do a lot of our development work focusing on maternal and child health, diseases, non-communicable diseases, as well as infectious diseases. And training is a critical component of everything that we do, training of health workers. So everything we do has to evolve around training of local health workers. And, most recently, we've expanded our work through Latin America, Asia, as well as Africa, and now domestic here in the US in response to COVID-19. We have close to 600 people working for us globally, and our work in the US now is expanding.
Wow. So, I can think of few people who have had as much experience as you in humanitarian and relief operations. And I guess I'd be interested to learn, in your view, what is making this particular crisis unique compared to others you've encountered? And maybe you can talk about some of the most difficult problems that you've had to overcome.
I mean, this has been a very difficult crisis to deal with. And one of the main reasons is that we are impacted in the crisis just as we're responding to it. Typically, the NGO world or the NGO organizations like ours, we respond to emergencies all over the world, but we're not that impacted. This time, we are impacted and we're trying to respond. And we're trying to respond in an unusual way without the ability to travel, without the ability to even go to the office. And it's really been a challenge for us to be able to do that and to pivot as well from, responding internationally to respond domestically and try to keep that balance in terms of priorities has been a challenge, not just for us, for everybody. And we want to make sure that by responding here at home in the US, that we do not forget the needs of the people that we're serving in many countries around the world.
Yeah, it's a difficult balance, I understand. Well, so, as I said kind of at the opening, few leaders in this sector have had the experience and record of successful leadership as you, Rabih. So tell me a little bit, what are some of the most important attributes for a successful leader in the sector, especially for those managing a global crises on the ground?
I mean, there are many different leaders out there. They're much better than I am, and I can tell you just about my experience in terms of
Sure.
how we go about doing our work. It is very important, especially in situations like this, for any leader, whether it's a CEO or a country director or an emergency response team leader, to be flexible and agile. I mean, we cannot go in, we don't have notebook that we go in and say, okay, this is what we're going to do. You go in and you see what the needs are, and you need to be really flexible and with a can-do attitude. You need to adapt to the situation, and also, very importantly, decision making is critical. I mean, you have to be able to make quick decisions, take quick decisions, and live with the consequences. One thing that we believe in at Project Hope is what we call a no regret approach. We look at a situation, any disaster or any emergency. If we say we're going all in. And, we want to be successful. We want to help people. But if we're not, it's okay. The most important thing is we responded based on what we know at that, or what we knew at that time. And whatever didn't work, we learn from it for the next one. But it is extremely important not to hesitate, to go in and to help people out. And, you do your best. That's all you can do. But the flexibility and the can-do attitude are critical for the success of any leader or any manager.
Yeah. It's difficult, isn't it? Because each time, any time you are responding to a disaster, that sort of the definition of the disaster is a complete mess. And so you really do need to, evaluate as much as you can and then really go forward. I hear you. So, on that, and somewhat related, many of the operating assumptions that we all had, the NGOs, humanitarian community, goodness, even people on an individual level had at the beginning of the year are now totally turned on their heads because of COVID-19. And so considering, your organization, Project Hope, what do you think will be the biggest organizational challenges in the next 3 to 9 months?
Wow, I mean, there are a lot, Steve. As you know, we're struggling with a lot of unknowns here in terms of the future. How are we going to be doing our work? Would we be able to go out to communities and serve the communities as we did before, or should we start looking at a different approach? In addition, one of the main challenges that we're looking at is, we have programs all over the world, and we're talking about programs that are dealing with women and children and patients with HIV or TB or diabetes. And those people are still suffering, probably at a higher rate. Well, I know at a higher rate than before COVID-19, but everybody's focused on COVID-19, and rightly so. It is a major crisis. I'm not diminishing that. Yeah. But at the same time, we cannot let people suffer from the other disease burden that they're dealing with. So our challenge is to make sure that those programs continue, that the funding for those programs continue, and also, most importantly, as we're focusing on US and Europe with the response to COVID-19, we know eventually we're going to have to deal with it in Africa and in the Americas and Asia. Yeah. How can we deal with it? Are we prepared to deal with it? And how can we also make sure that the donors don't lose sight of this, that it's not just the US and Europe. We need to deal with it here at home, but we cannot forget about the rest of the world, because unless we contain it everywhere, we will be dealing with this issue for a long, long time. And we know the health systems in those countries are not as prepared as we are. Here in the US, we saw the thousands of deaths so far and cases with one of the best health systems in the world. You can imagine how it would be like in West Africa, for example.
Yeah, that's right. No, I understand. I mean, what that was going to be my next question. I mean, we understandably, as you said, we're all being affected personally within our own organizations at our home base, and and it's understandable that Europe and North America have been somewhat inward facing for the last, goodness knows, 4 to 5 months. But these other societies are much more fragile. Sort of how optimistic are you that we're ready to respond and support these areas? And are there some things that you can? I know, and I'm sure you were involved heavily for Ebola crisis back 2014-15. I mean, are there any lessons we could take from that?
Yeah, I mean, listen. One thing I believe in is the human resilience. I don't think there's any crisis in the world that we did not overcome. So when it comes to us being able to respond to a crisis, whether it's in Africa or the Americas or Asia, I think we will. But it is important to understand that it's not going to be business as usual. we really need to mobilize our forces. We need to work together. That's extremely important. Not just the NGO sector, but the NGOs, the donor, the community, governments. We need to work together to overcome this. And we need to support local organizations. We cannot deploy staff all over the world with restrictions being as they are. And we've seen it over and over again when in countries where we see an uptick in the number of cases, the first thing they do is shut down airports, right?
Yes.
So if we're going to be deploying emergency response teams from here, we're not going to be able to respond. So we need to be very creative. We need to look at the local capacity and infrastructure and see how best we can support it. We need to make sure that they do get the PPEs that they need, but also funding. I mean, going back to your initial question, one of the things that all organizations are struggling with is funding because of the economic situation here in the US. Yes. And when you see unemployment, 20, 30 million people are unemployed now, you would understand that the funding is not going to come as it used to before. And when people have to choose between putting food at the table or donating $5, $10, $20 to a country that they might or might not have heard of before, I mean, we understand the choices that they have to make. So we need to make sure that this continues, that support continues and increases to support the countries. And at the same time, we need to recognize and acknowledge how generous donors have been, even in these extreme situations. Our donors, as well as I'm sure your donors and many other organizations' donors, have been really very supportive and generous. I mean, to a level that we didn't expect given the crisis now. Is that enough? Obviously, no, the needs are huge. We need to continue doing that. But at the same time, we do need to acknowledge that, we have some support. We need to make sure that we deliver on the programs that we have and really refocus the effort on where the needs are the greatest. Yeah. Hopefully we will contain the situation in the US soon. And it doesn't mean that the fight is over. Actually, the fight's just begun in Africa and other places. We need to focus on those. In terms of what we've learned from Ebola, I mean, unfortunately, the international community didn't learn much from Ebola. If you remember during the whole Ebola outbreak, one of the major things was the global health security agenda and focusing on preparedness and pandemic preparedness. Well, obviously, we didn't do such a good job in preparing and looking at pandemic preparedness. Look at what we're dealing with. Mm-hmm. But we've learned a few things in terms of the importance of communities and community involvement and the community resilience in countries where we work and making sure that we support them. We always believe, that, hey, we can bring the solutions to places. That's wrong. Solutions are there. What they need is the support, maybe some training and material, and they can actually come up with their own solutions. All we need is to support them. We don't have all the answers. So this is what we've learned from the Ebola response, and this is something that we need to apply now more than ever.
Yeah, that's right. That's an important point. I think supporting the local organizations and the communities. I mean, somewhat related to that, and I think you've talked about the need to be flexible. Many organizations have had to pivot, as you have, as Airlink has, as Project Hope has. And some have pulled back teams, they've closed programs, they've reduced staff. It's been a challenging environment. And so, in terms of, going forward, what is your sense of what the new normal looks like and kind of the working parameters under which humanitarian disaster response nonprofits will operate?
Yeah, I mean, as you rightly said, it's the new normal. We have to learn how to live with it. We're not going to go back to how we used to do business anytime soon. It's the new normal. And I think, one of the things that we've learned and that we've been working on is really localizing aid as much as possible. Focus on local organizations and local health workers and local first responders. You know very well, when a disaster hits, the first people that actually respond to that disaster are the local people in those communities.
Yeah.
And by the time we get there, we're talking 24, 48, 72 hours, or maybe even longer. Our job is to prepare them. and support them, and let them lead the response and let us support them. This is the new normal in terms of response. In terms of trainings as well. I mean, we've all been surprised by how successful we are working from home. I don't think anybody thought we're going to be able to do
That's
that.
right.
You know, mental health aside, in terms of being locked in at home, especially if you have teenage kids, like I do. But I mean, we can do a lot of things utilizing technology. And one of the silver linings of, this whole response is we've learned to take advantage of some of the tools that are available out
Yes.
there, such as, we're using now Blue Jeans or Zoom or Teams. Take advantage of those tools, deliver a training. We've just delivered a training with Brown University, and it's been extremely successful. I think so far we've trained about 15,000 first responders all over the world.
Wow.
And it was interactive, using whatever media we could. And probably this is one of the new normals as well
Yeah.
in terms of delivering training.
Yeah, that's tremendous. Yeah, I mean, I think that even for within my organization, it feels like we're even trying harder to connect with each other because we are so remote, and for some of us, it's the only social interaction we're having. In on a sort of on a casual basis outside of work related. So yeah, yeah, I hear you.
Yeah, I mean,
But that's great. The amount of people who are training. Sorry, carry on.
no, I mean, we do have to communicate as much as possible because everybody's feeling disconnected. I
Yeah,
don't know about you, but I think you're in the same shoes that I am in. I've been sitting in this chair since 7:30 this morning, and probably I'm
that's
still going to
right.
be here until 7 o'clock at night, on conference calls and communicating with our team, with the donors, with partners. And it is critical now because everybody's feeling disconnected because we don't have that human contact, the human touch.
That's
But
right.
at the same time, it is important for people to know that, you know, even though there's social distancing, we're still connected. We're still working for the same goal. We still have work to do, and it's feasible. It's
Yeah.
feasible. I don't want to do this for a long time. I would like to go back to the office and see my colleagues, but I mean, we're doing what we can with the current circumstances.
Yeah. Yeah, it's challenging. One thing I hadn't really thought of too much, but the work that we do is obviously humanitarian in nature, and not that you have to work in the humanitarian sector to care about other people, but the impact and seeing that impact and being engaged in that is a core motivator for a lot of people in our line of work. And so, doing it from your home office, your home desk, whatever, is challenging to get that connection, right?
Yeah, oh,
Um,
absolutely.
that's very, very challenging, yeah. So you touched upon it recently, and yes, funding donors are very very important, and I think that one thing I would say, and a question for you is, we often find, or I've found, the NGO humanitarian aid sector is sort of deeply fragmented, right? You could even go so far as to sort of say it's notoriously so. And I think you've already said, especially, the US public, we don't just focus on the US, but everyone's so heavily impacted economically by COVID-19. And so, it's even more important that the sector comes together. But do you think that's likely to happen, or do you think that's, that it's going to continue to be fragmented? Everybody adopts their own silo, and it's sort of an everyman organization for themselves.
That's a very good question. And listen, I think we've seen it before in major disasters and crises. The NGO community or the humanitarian aid community tends to come together as much as possible because for some organization, it's an existential problem now, whether they can survive, especially the economic crisis. And this is particularly true for organizations that are not working in health, for example. Because when you're dealing with pandemic, health is always, at the forefront. But I've seen it before. After 9/11, people thought, NGOs would no longer exist, and this is no longer the world for NGOs. You have to work closely with
Yeah,
the governments. We've seen it during the economic crisis in 2008, 2009. We saw it in the response to Libya and Syria, but somehow we've managed to survive and come out a bit stronger. But it is critical to work together. I mean, the humanitarian community at large, whether it's the NGOs or donors or the UN, we have to work together. Otherwise, we wouldn't be able to have an impact, especially as you rightly said, this is the new normal. We have to find ways to work together. And what's critical as well for the survival is that adaptability, being able to adapt to the new normal. Don't think that you're going to be doing business the same way you've done it a year or two ago. And regardless of COVID and the pandemic that we're dealing with, in our sector, you know that we need to continue to evolve. If we don't evolve, if we keep doing business the same way we've been doing it for the past 10, 15, 20 years, we would no longer be needed. We'll be obsolete. And we do need to adapt and evolve. And, if this pandemic is doing anything, is really pushing us much faster to evolve and work together. So I strongly believe that, we will be able to pull this through this and work together and really achieve quite a bit. And frankly, the world needs us to do that. I mean, as we said, the US and Europe probably will get it under control, but look at countries throughout West Africa or East Africa or Central and South Africa. We need to be able to work together in order to have an impact. We need each other because we don't have a presence in all the countries around the world, just like you and other organizations, and we need that partnership.
Yeah. It's interesting. I agree. You're absolutely right. I think new normal and we have to collaborate, and I know that Project Hope is doing a great job of that, and is a great role model for doing that. But in my mind, you almost sort of have to reinvent every time there's a new disaster, actually, and it feels like that. But this is certainly on a totally different level, right?
It is, and the old model of a cookie cutter approach doesn't work anymore. Just because you were successful in responding to this disaster with these tools, it doesn't mean it's going to work in another disaster. You just need to, go in with an open mind, find out what's going on, and see what would work best. It could be something that you've used before. It could be something new. It's just that mentality and ability to really read the needs and come up with creative solutions.
Yep. Got it. Good. So it's said necessity is the mother of invention. So what would you say has been the most profound change to the operations of Project Hope that have come out of working around this pandemic?
Oh, wow. I mean, it's a lot that we've learned in the past a few months. First of all, that it is actually possible to work, from home without being in the office. It's difficult, but it's possible. And also what we've learned is, the importance of communications and, sometimes over communicating. It's critical. We've always taken things for granted that people will know. Well, no, people don't. And we do need to actually take that step and over communicate as much as possible. But also the resilience of our teams, not just here at headquarters. The headquarters exists to support the field programs. That's why we exist. Our job is to support. But the resilience of our teams in the field has been just amazing. They found a way to continue working, to keep health services going, to keep community work going. Obviously they had to abide by the laws whenever there was a quarantine, but they managed to continue to deliver services. And this gave me and the entire team a strong belief that the solution is not just by the Western way of doing things. That's not a solution. The solution is there on the ground. The experience is just there on the ground. All we need to do is really empower those teams of local health workers, support them, and once in a while, if they need any guidance, guide them. But the most important thing is empower and support. And for me, it's been an amazing experience just to see over the past couple of months how the entire organization came together. People, whether in our offices in China, who had to deal with the outbreak initially, And from us supporting them to them supporting us now with PPEs, to our teams in Malawi and Namibia and Nigeria, Sierra Leone, Ethiopia, Colombia, Dominican Republic, everywhere. All of our teams came together as one family to support whatever other teams needed support. And this is critical. And for me, it's just been an amazing experience to see the entire Project Hope work together at such a pace and caring for each other. And if we've learned one thing from this is, again, I mentioned initially, is that the human resilience is amazing. Let's not underestimate that.
Yes, agreed. And so I think my next question was going to be, what would you say you're most proud of, within the organization so far? But I think you may have already addressed that one there.
I mean, I can name all of our teams here and in the field. I mean, our team has been amazing, and I couldn't have been prouder than, working for an organization with such an amazing team. I joined Project Hope 3 years ago, and I've been a CEO for less than a year, and we have an amazing team at headquarters in the field. We all work together. And but also the partnerships that came, again, the partnership between our two organizations, how we managed to be creative and help each other at the beginning, whether during our response in Wuhan in China, or even now bringing PPEs from China to the US. Other partnerships, the corporate sector that actually stepped up and supported us with funding for PPEs, supported you with funding for flights, and just this whole sense of community that we all, it's been said over and over again, we're all in this together, but it really feels that we're all in this together. And the only way out is actually if we stick together and continue to fight this together.
Yeah, understood. Well, I want to thank you for spending the time here. I mean, I think that, Project Hope's doing a great job. You don't necessarily need me to tell you that, but I know that from even early days in Wuhan, you guys, I think, have been there for over 30 years, right? And so you've played quite a unique role and been really connected to all of the key sort of focal points of where the spikes have occurred. I want to thank you for joining me today, Rabih, and thank you for all the work you and your team at Project Hope are doing. For their tireless dedication and for helping communities in crisis around the world. And so until our next episode, this is Steve Smith in Washington, D.C., wishing you and your families well. Goodbye.